Hello friends, welcome back to my channel Medical Concepts in Brief. So after alpha receptors today, now we will do the beta receptors. Now main beta receptors are the B1 and the B2. Let's have a quick recap on the various places where you can find the beta 1 receptors. So beta 1 receptors, now the way to remember this is just create a memory diagram. So let's say this is beta 1, so just assume this as a heart. So this is the atrium, this is the ventricle. So here you have the SA node and here you have the AV node. So this is your SA node, this is your AV node. Then let's suppose this is your ventricle, so this will be your ventricular muscle. Then this is also your atrial muscles, and in the center we have the Purkinje system. Okay, and then at last we have another organ, that is kidney. So we can draw it here separately. So let's say what all are the different places and what is their effect. So first is your SA node. So SA node, what it does, it will increase the heart rate. So it increases the heart rate. So this increase in heart rate is also known as positive chronotropy. Positive chronotropy. Similarly for AV node, this is also increases the heart rate and known as the positive chronotropy. So whenever the heart rate increases, so that is known as a chronotropic effect. Next we have the Purkinje system. So in the Purkinje system, it leads to increased conduction. So whenever we talk about conduction, so we mean that the conduction velocity is increased. So this is known as positive dromotropy. So positive dromotropy effect is now seen. Now the fourth one, we have the muscles, that is the muscles of the atrium and the ventricle. So they are going to be increased in contraction, and this leads to for increased force of contraction is known as positive ionotropy. So these are all effects which are occurring at the heart level. Now the fifth place, that is the kidney. So in kidney, what it does, it increases the renin release. As you remember, in the alpha receptors, basically alpha 1 receptors, they are also present in the kidney, but they decrease the release of renin. So this is all about the beta 1 receptors. Let's do it a quick recap for this. So here is your part. So these are the 4 places where you will have the beta receptors. So first is your, so right now we will just talk about the receptors. So I will not write about the function. Function you're going to tell me afterwards as I say the site. So first, let's say, and the last organ here is the kidney. So this is your kidney. So the first is the AV, the SA node. So SA node, it increases the conduction, increases the heart rate. Then second is your AV node, second place is the AV node. Then here also it increases the heart rate, that is known as a positive chronotropy. Then you have the Purkinje system. So in the Purkinje also it increases the conduction. You have for the atrial and the ventricular muscles, atrial and ventricular muscles, where it increases the contraction. And at last you have the kidney, where it increases the release of the renin. So this is the simplified diagram for this. So these are all the different functions of beta 1 receptors. Now coming to the beta 2 receptors. So beta 2 receptors, so the way we made a diagram, so here also I'm going to make another diagram. So how you are going to remember is that on the bottom you have two. So here you have two organs which it's going to basically represent, and on the top here you have one organ, that is your uterus. Okay, so this is your uterus, and on the vertical line of this B, so this is your bronchioles, this is your bronchioles, this is your uterus, this, and here let's say we talk about all the different blood vessels, so we'll just do a branching pattern of the blood, different blood vessels. So here arterioles as well as the venules, so we'll just draw the arteries in red. So let's do this branching. So all these are the different arterioles so arterioles as well as the venules both have the beta 2 receptors. Then we have on this outer part, let's now in the beta 1 we made it artery muscle, so here we are going to make it skeletal muscles. So the skeletal muscles, so these are the skeletal muscles. So this is all in a nutshell the different location for the beta 2 receptors. Don't forget, so this is the beta 2 receptors. Now we'll talk about each function. So the first that we have here, the first, this is the uterus. So what it does in the uterus, so in general what you have to remember is that beta 2 receptors basically lead to relaxation. So in the blood, in the uterus, it will lead to relaxation of the uterus. Now the second place that you will have here is the bronchioles. So bronchioles, again they are lined by smooth muscles, so it will lead to dilatation of the bronchioles. Then here also we have the smooth muscles. The third location is your blood vessels. So blood vessels may also lead to dilatation. So dilatation will lead to decrease in the total peripheral resistance. That decreases the preload, or the decreases the afterload. So it decreases the afterload, and it also basically decreases the diastolic pressure. So this was all about the blood vessels. Now we have the third location. Here we have two organs, as the beta 2 I told you how to remember. So here we have two organs which we forgot just. So here I'll just draw the two organs. So first is my liver, and then you have the pancreas. Okay, so these are the two organs where you also have the beta 2 receptors. So here the fifth part, so here you have, the fourth region is the liver. So in the liver it will lead to increase glycogenolysis. And next we have the fifth is the pancreas. So in the pancreas it basically increases the insulin secretion. So if you remember the alpha 2 receptors, so alpha 2 receptors was there in the pancreas, but there the function was different. The function was it decreases the insulin release. So here in the beta 2 receptor leads to increase in the insulin release. So this in a nutshell summarizes the different places where you have the beta 2 receptors. So just revise it again. Beta 1 receptors, they are present on the SA node, AV node. They are present on the SA node and the AV node, where it increases the heart rate and it causes a positive chronotropic effect. And then in the Purkinje system, it increases the conduction velocity, so that is a positive dramatropic effect. Then you have the atrioventricular muscle, where it increases the contraction, and that is known as a positive inotropy. Then fifth is the kidney, where it increases the renal release. Next we have the beta 2 receptors. So beta 2 receptors, they basically are present on the smooth muscles. For example, in the smooth muscle of the uterus, where it leads to relaxation. Then in the bronchioles, it leads to dilatation. Then it has present also on the different blood vessels, the different venules and arterioles, where it leads to dilatation, increases the TPR and decreases the diastolic pressure. Now we have the two organs. One is the liver and the pancreas. So in the liver it increases the glycogenolysis, in the pancreas it increases the insulin. So that was all about the beta receptors. Thank you for watching. Please do like, share and subscribe my channel, and do comment in the section in which topic you want this brief medical concept video. Thank you.